CSP-USAEBN Ebola HF Preparedness. What is Ebola HF? Ebola hemorrhagic fever is a zoonotic disease transmitted to humans by direct contact with infected live or dead animals, and more specifically with their body fluid, similar to the way HIV is transmitted. Ebola transmission. When an infection does occur in humans, there are several ways in which the virus can be transmitted to others. These include direct contact with the blood or secretions of an infected person, exposure to objects, such as needles, that have been contaminated with infected secretions. EHF is not airborne. Canadian research has proven the Ebola is not transmitted through the air. However, it did prove that low amount of spittle can travel up to 6 feet away and be contagious. This study also showed that swine, pigs, are more contagious to humans than primates are. The viruses that cause Ebola HF are often spread through families and friends because they came in close contact with infectious secretions when caring for ill persons. During outbreaks of Ebola HF, the disease can spread quickly within healthcare settings, such as a clinic or hospital. Exposure to Ebola viruses can occur in healthcare settings where hospital staff are not wearing appropriate protective equipment, such as masks, gowns, and gloves. Proper cleaning and disposal of instruments, such as needles and syringes, is also important. If instruments are not disposable, they must be sterilized before being used again. Without adequate sterilization of the instruments, virus transmission can continue and amplify an outbreak. Death rate is between 50 to 80%. Symptoms of Ebola HF typically include fever, headache, joint and muscle aches, weakness, diarrhea, vomiting, stomach pain, lack of appetite. Some patients may experience a rash, red eyes, hiccups, cough, sore throat, chest pain, difficulty breathing, difficulty swallowing, bleeding inside and outside of the body. Symptoms may appear anywhere from 2 to 21 days after exposure to Ebola virus, though 8-10 days is most common. Some who become sick with Ebola HF are able to recover, while others do not. The reasons behind this are not yet fully understood. However, it is known that patients who die usually have not developed a significant immune response to the virus at the time of death. Treatment. Standard treatment for Ebola HF is still limited to supportive therapy. This consists of balancing the patient's fluids and electrolytes, maintaining their oxygen status and blood pressure, treating them for any complicating infections. Timely treatment of Ebola HF is important but challenging since the disease is difficult to diagnose clinically in the early stages of infection. Because early symptoms such as headache and fever are nonspecific to Ebola viruses, cases of Ebola HF may be initially misdiagnosed. However, if a person has the early symptoms of Ebola HF and there is reason to believe that Ebola HF should be considered, the patient should be isolated and public health professionals notified. Supportive therapy can continue with proper protective clothing until samples from the patient are tested to confirm infection. USAEBN Emergency Operations Center will continue to monitor this outbreak and report any significant changes to you on our digital broadcasting station and website, social media outlets. During any type of disaster, Relief organizations like the Red Cross and FEMA will not be able to get to you for a few days, so it is up to the individual to prepare for his family during times of crises. The need to educate the public on the basics of disaster preparedness is critical. It is not up to the government alone to provide this information, but local communities and businesses must step up to the plate and help educate the local populace. USAEBN has developed a mobile application that is available on both the Play Store and the Apple Store. The application is free to download and it is designed to give you emergency information in your area, plus a free communicator to send your GPS location in text messaging. Remember, disaster preparedness is as simple as ABC. A. Always be informed by listening to USA Emergency Broadcasting Network. B. Build a disaster kit. USAEBN Marketplace has the equipment that you need. C. Create a family emergency plan. Attend training offered by USAEBN Prep Academy.